Hello everyone. Imagine waking up one day and something doesn't feel quite right. Your body doesn't move as it should, your speech becomes slurred, and your usual strength feels like it's slipping away. That's how suddenly a stroke can happen, disrupting life and leaving lasting impacts. Stroke is a serious condition that can unexpectedly change a person's ability to function in their daily life, and it's essential to understand it for the sake of prevention, early intervention, and effective treatment. Today, we'll take a comprehensive look into the causes of stroke, the process of disease progression, and a breakdown of the different treatments available. We'll also go over the benefits each treatment offers and how they affect the areas of the brain most impacted. This video will give you a deep understanding of what you need to know to safeguard your health and the health of those close to you. Let's begin. First, let's understand what causes a stroke. A stroke occurs when blood flow to a part of the brain is interrupted or severely reduced, causing brain cells in that area to die due to a lack of oxygen and essential nutrients. Since brain cells cannot survive for long without oxygen, even a temporary disruption can have severe consequences, resulting in damage within minutes. There are two main types of stroke: ischemic stroke and hemorrhagic stroke. An ischemic stroke, the more common type, accounts for approximately 80% of stroke cases. It happens when a blood clot forms in the blood vessels, blocking the flow to the brain. This type of stroke is often the result of a buildup of fatty deposits, plaque in the arteries, or other blood flow abnormalities due to factors like high blood pressure, diabetes, high cholesterol, or lifestyle choices such as smoking or a sedentary lifestyle. The clot itself may form in the brain's blood vessels, or it may develop elsewhere in the body, like the heart, and travel to the brain. On the other hand, a hemorrhagic stroke is caused by a blood vessel rupture, leading to bleeding in the brain. This can result from high blood pressure, head injury, or aneurysms, which are weakened areas of the blood vessel that bulge and may burst under stress. When a blood vessel in the brain bursts, blood leaks into the surrounding tissues, creating pressure that can damage brain cells and lead to a more widespread impact, sometimes affecting both hemispheres of the brain, depending on the severity. Risk factors contributing to stroke are diverse, including high blood pressure, heart disease, diabetes, high cholesterol, obesity, and excessive alcohol or drug use. High blood pressure, in particular, is a significant contributor as it strains blood vessels, making them prone to rupture or blockage. Understanding these causes and risk factors is critical because it highlights the importance of a proactive approach to health, such as regular checkups and managing underlying health conditions to reduce stroke risk. Treatment for ischemic stroke. For ischemic strokes, treatment typically focuses on restoring blood flow to the brain. One of the primary methods is thrombolytic therapy, which involves using clot-busting drugs like tissue plasminogen activator (TPA). When administered within the first 3 to 4.5 hours after the onset of symptoms, TPA can dissolve the blood clot blocking the artery, allowing blood flow to resume and minimizing damage to brain cells. This treatment can significantly improve outcomes for stroke patients by restoring oxygen and nutrients to the brain cells, thereby increasing the chances of recovery. Another advanced treatment option for ischemic stroke is mechanical thrombectomy, a procedure used for large clots. In this procedure, a catheter is inserted through an artery in the groin and navigated to the blockage in the brain. A device is then used to grab and remove the clot, restoring blood flow. This technique is usually reserved for more severe strokes, where a significant blockage has occurred and must be performed within 6 hours of symptom onset, though in some cases, it may still be effective up to 24 hours later. Mechanical thrombectomy has become a breakthrough in stroke treatment, especially for those whose condition makes it impossible to use thrombolytic therapy alone. The impact of these treatments goes beyond merely removing a blockage. They are crucial in reducing the risk of long-term disabilities that can arise if brain cells are deprived of oxygen for too long. Each minute saved in the treatment of ischemic stroke significantly improves the patient's chances of avoiding permanent damage, which can include mobility issues, speech difficulties, and other cognitive impairments. Treatment for hemorrhagic stroke. Hemorrhagic strokes require a different approach, as they involve managing bleeding rather than just clearing a blockage. When a blood vessel in the brain bursts, causing blood to leak, immediate steps are taken to reduce the pressure on the brain. In some cases, surgical intervention is necessary. For example, a surgeon may perform a procedure called a craniotomy, where part of the skull is temporarily removed to allow access to the brain, stopping the bleeding and relieving pressure. This helps to prevent further damage and gives the brain space to swell without causing additional harm. Another technique used to manage hemorrhagic strokes is endovascular coiling, where a catheter is inserted into an artery and guided to the site of the bleed. Through this catheter, small coils are placed in the blood vessel, which encourages clotting and reduces further bleeding. In some cases, clipping is used, where a small metal clip is placed at the base of an aneurysm to prevent it from bursting again. Each of these procedures is highly technical and must be carried out in specialized medical centers. The goal of these methods is to reduce intracranial pressure, protect the surrounding brain tissue, and prevent additional bleeding. Hemorrhagic strokes can be particularly damaging, as they can lead to widespread damage within the brain, affecting multiple regions and causing more complex complications. Benefits and effectiveness of treatment methods. The effectiveness of each stroke treatment depends on several factors, including how quickly the patient receives care. For ischemic stroke, thrombolytic therapy is highly effective if administered promptly, with studies showing that patients who receive this treatment are significantly less likely to experience long-term disability. The mechanical thrombectomy technique has revolutionized the management of severe ischemic strokes by providing an option for large blockages, offering patients a better chance at recovery, even in more serious cases. For hemorrhagic strokes, surgical options like craniotomy and endovascular coiling have proven essential in managing bleeding. These procedures not only reduce the immediate risk of death, but also give patients a chance to regain some of the functions that would otherwise be permanently lost. Although hemorrhagic strokes often lead to a more extended recovery period, modern treatment options have greatly improved the outcomes for patients, allowing for higher quality of life post-recovery. These treatments highlight the importance of timely intervention. Getting the right treatment at the right time is crucial to improving recovery outcomes and preventing long-term damage. Each minute counts, as brain cells are extremely sensitive to oxygen deprivation. Impact of treatments on affected areas. The specific impact of treatment on affected brain areas varies according to the type and extent of the stroke. Thrombolytic therapy for ischemic stroke restores blood flow, delivering oxygen and nutrients to previously deprived cells, which may significantly minimize brain damage. This is particularly beneficial in areas controlling essential functions like movement, speech, and cognition. For hemorrhagic strokes, treatments like craniotomy and endovascular coiling alleviate pressure and prevent further bleeding, preserving the function of neighboring brain regions. By managing intracranial pressure, these procedures protect areas responsible for critical tasks, reducing the risk of widespread impairment and helping patients retain as much functionality as possible. These treatments, tailored to the type of stroke, highlight the progress made in modern medicine. They not only save lives, but also preserve a patient's ability to live independently and enjoy a fulfilling life. We hope this information has provided you with a clearer understanding of stroke and its treatments. Strokes are life-altering, but with the right information, quick response, and access to effective treatments, recovery and quality of life can be significantly improved. Remember, time is of the essence. Recognizing the signs of stroke and seeking immediate help can make all the difference. Thank you for watching, and please consider sharing this vital information with anyone who might benefit from it.